Hi, my name is Chelsea Bucciarelli, and I'm going to be doing the heart video checkoff for Health Assessment Lab. So beginning the assessment, I would walk in the room and wash my hands, but due to the circumstances, I'll just announce that I've washed my hands prior to the assessment. Hi, my name is Chelsea.
Hi.
I'll be your nurse today. How are you doing today?
Good, how are you?
Good. Can you identify yourself for me?
Maria Teodora.
Good. And then your birth date.
05/27/2001.
Okay. Do you have any allergies?
No.
Are you in any current pain?
No.
And having trouble breathing?
No.
Okay, and then we'll inspect the general status of the patient by simply looking at them, looking at their posture, like making sure they're not like hunched over in any pain, if they're in any distress, if they have any visible wounds, and then look at their breathing. Is it labored? Is it heavy? Are they having trouble breathing? Do they need oxygen? Things such as that. And then we would go to look at their heart rate. And I will sit down so the patient feels more comfortable with me next to them. So I'll look at their heart rate by looking at their radial pulse. So to do the radial pulse, we'll feel the radial pulse for about 30 seconds, which I'll use my watch for, and we'll multiply that by 2. Okay, so I got a reading about 36 beats per minute, or beats per 30 seconds, and then we'll multiply that by 2 in our heads, which will give us 72 beats per minute, which is a regular heartbeat. Regular heartbeats fall within the 60 to 100 beats per minute range, and then we'll assess the strength of her pulse, which I would say is a 2+ grade, which means it's not very strong and bounding, but it's also not diminished and weak. So next we'll assess her respiratory rate. By doing this, we can look at her inhalations and exhalations per the minute. So I'll just do that by observing her breathing. Okay, so she had a respiration rate of about 7, which would multiply by 2 for 1 minute, which will give us 14. And the normal respiration rate is supposed to fall in between the 12 and 20 mark. So she has a regular respiratory rate. Next, we're going to inspect the neck for a jugular venous distribution. So we'll have the patient lie about a 45-degree angle, slightly back, but not all the way back. We'll look at her. We'll examine her trachea and her jugular area, see if there's any tumors, any bulging. You want to see that it's flat. You don't want to see any bulging of the veins. And then using these 2 rulers, we'll do the jugular venous distribution test, where we find the sternal angle here, and then we also find the carotid pulse, and we see the measurements in between the 2. So her carotid pulse, carotid pulse would be around here, and then we would find her sternal angle here, and we would look at the centimeters and measure. Then I find that it's about 4 centimeters apart, which is normal. Above 4 centimeters or extremely higher than 4 centimeters would be considered abnormal, and that something's wrong. Next, we'll inspect, palpate, and auscultate her carotid arteries. I'll be using my stethoscope. We'll use the bell on it. So using the bell, we'll look at the angle of her jaw. We'll look at the mid-cervical area and then the base of her neck. We'll listen for her respiration, and then we'll listen for breweries, which is like a loud swooshing. So her breathing should be normal. We'll just hear inhale and exhale. Whereas if it wasn't and her respiratory tract was clogged or something was blocking it, we would hear these breweries. So I'm going to start by looking at the angle of the jaw here. Can you inhale for me? Exhale. Then we're going to look at the mid-cervical area. Inhale. Then we're going to look at the base of her jaw, base of her neck. Okay, and then I find that everything's normal, everything sounds right, so we would not find any breweries. And then I will also repeat this on the other side of her neck. Inhale. Good. 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 And just like the other side, we find the same thing. Nothing is blocking the pathways and it sounds normal. Next, I'll palpate her neck, make sure there's nothing here, and then we'll feel for her carotid pulse. Make sure it feels normal. So you feel that it's just a regular pulse, it feels smooth, nothing irregular. Next, we'll auscultate her heart, and we'll be looking at the 5 different areas. We'll look at the aortic here, at the second intercostal space, the pulmonic, the herbs, the tricuspid, and then the mitral down here, which is also our apical pulse. So I'll start with her aortic. Okay. Then all the heart rates seem about normal. Let's see. I'm supposed to do that. Then I'll repeat this process with the bell. This process with the bell will look for heart murmurs as it is more, it picks up more. It's more accurate a reading. Okay, then again, with using the bell, everything sounds normal. No, we don't hear any crackles. We don't hear any wheezing of any sort. No abnormalities. Next, we'll look at the apical pulse, which is looking back at her mitral pulse area underneath here by the 5th intercostal space. And then just like the heart rate, we'll count the pulse for about 30 seconds, then multiply by 2. Okay, so we found about a reading of 40 beats per minute at the apical pulse. This tells us that she has a apical pulse rate of 80, which is again normal because it falls within the 60 to 100 beats per minute. We're gonna palpate the chest and apical pulse, feel for any like thrills or heaves, which is like feeling for vibrations of the chest, any abnormal beating of the heart. I'm gonna come under here, check that spot again. And everything seems to be normal. We don't feel any vibrations of the chest or other abnormalities. Next, we'll inspect her upper extremities, which means like her arms, her brachial pulse. We can also check the radial pulse again, I guess, but it was already done in the beginning, so we're not going to redo it. I'm going to look at the capillary refill on her nails and then check her brachial artery pulse. So we'll look at her nails by pushing on her nail bed for 1 second and seeing how long it takes to become red again, which shows the blood flow. So it's about a 2-second refill, which is again normal. We'll look at both her arms at her brachial arteries. Okay. We find that the pulse is regular, their heartbeat is regular, the pulse is about a 2+, maybe 1+. It's not as strong as the radial pulse we found earlier, but it is still there. Like I said, it's a regular heartbeat, nothing should be wrong there. Next, we'll palpate the ulnar artery, which is the other side of the radial, so that'll be on the inside of the wrist, the pinky side. Just feel any abnormalities. And you want to do it on both sides. And the pulse seems to be regular also. Next, we'll inspect the legs and her feet. So we'll have her put her feet up. Sorry, I'm gonna roll your pants if you don't mind. So here we just want to look at her legs, look at the colors, make sure it's not, make sure it has a redness to it, make sure it's getting blood flow. We want to look at the hair growth, make sure it looks regular, any swelling, edema. We can push on the shins here, see if there's any edema, any depressions caused. No. Are you feeling any pain in your legs today?
No.
No? Okay. So then we're going to palpate the pretibial area pulse, which is behind the knees here. Okay, seems about regular. Then I'm going to have you pull that pan of blood too. Thank you. Alright, seems regular. And then back to the edema on our legs, we would say it's probably about a 1+. There's nothing really going on here. And then we're gonna go look at her feet. We're gonna palpate the posterior tibial pulses, which is on the inside of the ankle, right behind here. And we can feel the pulse very strongly here, so I would say it's about a 2+ to a 3+, and the pulse feels regular. Okay, and then we'll palpate her dorsalis pedis, which is on top of her foot here. So we could follow along the top of the foot here. Then again, we find that the pulse is regular, and this is probably like a +1 grade. It's not very strong, but we can still feel it. Then lastly, we would check the capillary refill on her toes. Just like your fingers, we would check to see if the toes are regaining their redness. Yep. And then that is the end of the assessment. We would end it by asking the patient if they have any questions or concerns. Do you have any questions or concerns about the assessment? Any pain? No?
No.
Okay.
Thank you.
Then I guess that would be the end of it. Hello, I'm just adding this towards the end of my video because I realized that I missed some things in the other video. I don't have my patient anymore, so I'll just explain it on my own body. It's only 2 things. I realized that when I explained the heart auscultation, I didn't specifically say where I was looking at, like the 5 points, so I'll say it now. The aortic, the first point we would look at is the aortic, which is at the sedicate intercostal space along the right side of the patient, and then we'll move across the pulmonic, which is also the second intercostal space, but it's on the left side of the patient. Then we'll go down to the third intercostal space. It'll be the Erb's point. Then we'll go to the 4th one, which is the tricuspid. And then lastly, we'll go to the mitral, which is where the apical pulse is. And that is along the 5th intercostal space, but it is along the midclavicular line. So you would go down from your clavicle to the 5th intercostal space. Next, I did not examine the hands of my patient. I looked at the capillary refill on her fingernails, but I didn't inspect her hands. So what you would do is look at the hands for any abnormalities. You would compare them for, make sure they're symmetrical, there's no swelling or edema. Look at the color, make sure they're not like a bluish hue, that they're getting enough blood flow. And then you could also test the range of motion within the fingers. Have your patient pinch against their own fingers. Make sure that they can move them normally. And then that's it.